Thank you, Sahani sir and Dr. Dimisha Mehta. Good evening, good afternoon, and good morning. This is the 1649th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Rashmi Shukla. Let us begin the session with 1 minute silent prayer. Thank you all. Let us begin the session with 1 minute silent prayer. And now it's time to begin the session. And let me come to today's guest. As you all know, today our guest is Dr. Rashmi Shukla. She has completed her MD and is the founder and CEO of HOMEOED. And she has more than 16 years of clinical experience as well as 12 years of teaching experience. And she has presented so many papers and published many research papers in different journals. And she has won many awards, and she is the winner of Pride of Homeopathy at World Health Summit JW Marriott Dubai in 2022. As you all know, we have 3 sessions every day. The first session of the day is already over in Hindi, and the second session is an international session that is from 8:30 to 9:30, and a local language session from 10:30 to 9:30 to 10:30. We are sorry to say that from today onwards, there will be a problem with uploading the videos, as there was an objection from the YouTube officials about our one video. So we will upload the videos of some of these days, or will in the later part of this month, or sometimes in the next month, as and when they give permission to release the same. Anyway, let me come to today's guest once again. As you know, Dr. Rashmi Shukla has produced some of the best presentation in this forum, and she had made 3 sessions about homeopathic research in this forum. And today, Dr. will be discussing in a different subject, concept of cure and gray line between curable and incurable diseases in homeopathy and modern perspective. Let us proudly welcome the guest of the day, Dr. Rashmi Shukla. Welcome, madam.
Yeah. Thank you, sir. Thanks for the nice introduction and the inviting me for and giving me the opportunity. And as every time I give lots of bad news, but this time I'm going to give good news. And here we are going to have our upper hand, because homeopathy had survived so far only over its merit and ability to create the results. No government, even if endorse us, we still are surviving, not only in India but also out of India, various countries, and in the hearts of various people whom we have served, and who really believe in homeopathy. And I think the number is almost 300 million people worldwide who choose to take homeopathy. And probably if you give me an opportunity, then I'd like to share that worldview also, that to which countries, what extent the homeopathy has been endorsed, and how it is growing or degrowing, and what are the measures that we as a homeopath, and being a strong governmental infrastructure having been supporting us, how we can have lead the world homeopathy demography. So thanks once again. I thank Sani sir also. And here I would like to have some interaction at chat box, because it is more of a manthan and not lots of deliveries, because I really can't dare to teach or show my gyan, because I can see Dr. Ravi Singh sir, Dr. Ram Pravesh sir, and so many senior, Dr. George sir, so many seniors are already there, so I hardly can dare. I'm just sharing what I have experienced, what I have found in literary research, limited small period of practice as compared to you all guys. So I hope my screen is visible.
Yes, it's visible.
Perfect. All right. So this topic was very carefully chosen, as in the sustainability and survivability of homeopathy is totally based on its. I just started with the topic that it's totally based on its ability to create the results. And here we are going to focus on what is incurable diseases. So you see, and what are the modern terms of incurable diseases, and actually what is real incurable diseases. So it would be a great mind-blowing things that would be coming up, and I hope you can just अपने कुर्सी की पेटी बांध कर you will see that wonderful facts checking will be coming up for your reference. So first of all, I would like to start with the concept of disease, because we should know what exactly we are trying to cure. So a disease is basically a functional or physical change. Here I will cover both the perspective, modern perspective and homeopathic perspective, because you see, the modern and homeopathic perspective both has little difference and little overlap. If you see the concept of disease at the time of Hahnemann, you can read the introduction and you see how primitive they were, and that's why Hahnemann called as old school medicine. And the founder of homeopathy took all the credit to rename that system in the form of allopathy, which is proudly called as nowadays as allopathy. Is also, we take that pride with us that our master was the one who entitled term allopathy to the other system. So here we will cover both the aspect, so that we can see the similarity and difference and comparative analysis. So concept of disease, basically disease is a functional, and this is the modern definition. Disease is a functional or physical change from normal state that affects the health of a person by causing disability or discomfort. For example, right now I am having sore throat, slight fever, and little uneasiness. So I am sick, okay, and I'm really sick. So similarly here, you may or may not have any demonstrable anomalies or symptoms or structures, still you can be called as sick, because even if you're sensing that you're unwell, you are actually unwell. Now, coming to the homeopathic concept, we have several pioneers coming at a different part of time, where we found they evolved the concept of disease according to their uh, era, and which was in tandem with the advancement that was happening in the contemporary system of medicine. So here, when Hahnemann was there, not even the discovery of cell had taken place. So he had actually, for his naked eyes or his logic, he could not just imagine that there are cells and there are so many things, forget about DNA and everything. But he said somewhere something which is actively deranging the internal balance or harmony, and mostly morphic agent. You will see always he has mentioned in Sora, in the chapter of Sora, time and again, about the morphic agent. It means that even years before Robert Workow, when he discovered the tubercular bacilli first time, Hahnemann could says that there are certain contagious and infectious thing, material which is invisible, because bacteria are invisible. So that's how he is technically right. So dynamic derangement caused by morphic agent means he is also promoting the infectious theory of the diseases, internal or external to the body, was the primary thing that he propagated. Every diseases begin in the mind. When Kant came up, he, by his time, you know, various infectious diseases, the theory of infectious diseases had already been discovered. So by then he could say that every disease begin in the mind, because he was playing around immunity and psychosomatic aspect of immunity he was playing with. So that's why he promoted the fact that every disease begin in the mind, and the body is affected consequently because of whatever abnormal vital processes that change the condition of life, and which is inimical to the true development of individual and tends to organic dissolution. So this is how he has evolved, that every disease starts in mind and later on to various structures it comes up. To an extent, yes, it is partially definitely true. Now, what basically every concept of homeopathy is hinting at is lack of harmony. More or less, lack of harmony is something everyone with their theories of disease try to tell, that something deranges, something imbalance, something that harmony is lost. And lack of harmony is something which every of our masters try to propagate. Now, now I would like to, like, actually go back whenever the sessions are over and search over Google what is cure. And surprisingly, you would not find any satisfactory definition of cure. You see, there would be a lot of hypothetical things, but they won't say that that's a total recovery of cure, because unke hisab se cure has actually become a hypothetical thing and something which is unachievable. And that's why they have brought up the law that we cannot claim that we are curing a disease, because disease cannot be cured anytime for that matter. Here, that's why they have strategically put up the definition that to heal, cure is anything to heal or restore health, a treatment to restore the health. Cure is a substance or procedure. Even treatment and processes also can be called as cure, that ends a medical condition such as medication or surgical operation, lifestyle modification, or even the philosophical side also of the cure. Now, here, what homeopaths are believing or willing or aspiring is that the cure is restoration of altered vital force into normalcy to make the functions normal in all three spheres: body, mind, and spirit. Now, when Hahnemann, in his definition and elaboration of cure, when he started narrating that cure is total restoration of altered vital force, it means that he also quoted very well that it is not just the disappearance of the symptom, but total annihilation of the internal deranged vital processes. So he just did not believe that, okay, you had fever, now you have no fever, you're cured. No, he said everything has to be restored structurally, step by step, in all senses. That his body should be restored, functioning normal, his mind and spirit also. Now, after you can see my screen, now you tell, here we are trying to churn over what is curability quotient. Being acute makes a disease curable, or being chronic makes a disease incurable. So you can, the chat box is open and you can put up your thoughts, because I would definitely like to have your views also. COVID, headache, asthma, or heart attack, these can be an acute episode, acute exacerbation of chronic disease, or frank acute diseases. So even acuteness is curable, then probably not, because heart attack is also acute condition and which may not be actually permanently curable. Now, if you see, chronic diseases are incurable. So how many of us we could have cured gout? How many of have cured, you see, the not cured here, I would say, but how many of us have actually recovered many of the variety of arthritis? And yes, technically it is cure, because they are saying that even if you are treating and restoring the functions, still it can be called as cured. So cancer, chronic, how many, most of us have experienced that they could recover the cancer also, COPD also, and also many of us have experienced that we had been able to successfully recover diabetes, where the sugar levels are normal, patient is off insulin or off any anti-diabetics and still maintaining nice sugar and not really, requiring any medication, provided he is maintaining a lifestyle. So here we can see that just a disease, because it is an acute, it is not important, that it is not really essential that it would be curable, and it is not essential. If a disease is chronic, it doesn't make it incurable. Okay, so many more surprising factors. Keep watching. You would actually blown with the facts that are coming up round and round. So curability, have you seen, I mean, almost most of us have seen that a spoiled acid peptic disease. I have heard one greatest gastroenterologist of Nagpur saying that, ma'am, I don't remember I could cure any of the constipation patient. Cure? Yes, of course. They don't have cure for constipation. They don't have cure for hyperacidity. All they have is something that relieves them for 24 hours or some days, and then again patient is supposed to get it. So they also know it very well that there are many functional diseases which may not be cured. So acid peptic disease, panic disorder, seizures, chronic pain syndrome, where no structural or pathophysiology is found, still there are pains. So these are chronic pain syndrome. So functional diseases, sometimes you see seizures are not curable, they don't recover, they keep on relapsing. So essentially they are not fulfilling the definition of cure. So even just a disease is functional, that doesn't make it curable. Again, if a disease is structural, you see atherosclerosis, if you see tumors, if you see chronic kidney disease, if you see PID, prolapse intervertebral disc. So you see here the structure is involved. But how many of have seen that, a lipoma, a fibroadenoma, even the malignant tumor, or tubercular lymphadenitis, a form of tumor where we have we could see the structure is altered. How many of us have even could recover the CKD, like chronic kidney disease, or the renal medical disease? CKD is essentially a structural one, and PID. So, and don't go far. We daily cure, the renal calculi are ekdam baएं हाथ का खेल. We just can restore that and expel that tumor. Sorry, a stone. So it's structure, right? And still we can handle that. So again, a disease being functional or structural does not make it curable or incurable. Now you will see more fun coming up. Now curability quotient, next thing. What actually here we are trying to do a manthan over what makes a disease curable or what makes a disease incurable. If you see infectious diseases, um, uh, no, right? If it is a viral, probably you could see that it is recovering. But if you see HIV, HBsAg, so probably you won't see that body is totally getting rid of it and curing it, essentially fitting it in the term of cure. Again, many of the deficiency diseases, to an extent, yes, because if you restore the deficiency, yes, they are recoverable, but there could be certain after effects of deficiency that may not be recoverable. If you see hereditary diseases, because I am trying to cover all the spectrum of illnesses, whether they are curable or not curable, we can see 100% diseases which are hereditary. Here we have to understand that what we are talking about actually. Hereditary means not the congenital. Congenital, essentially, when they born with, they are likely to carry it and probably may not recover. For example, Marfan syndrome, Down syndrome. So here probably the patient will never recover to normal, and that even we homeopath have accepted that we may not be able to really create a cure, essentially. But hereditary diseases, you see, if you have a strong history of IHD, if you have a strong history of diabetes, you see, if the person is taking care of lifestyle, probably we can delay the onset of disease. Probably he will definitely have it. Probably if he is intervened with right homeopathic medicine at a right age, probably he will never have it, or very later stage he will have it. So there are so many variables coming up when it comes to curability of hereditary diseases are concerned. And there are lots of physiological diseases. If you see, I'm sorry, it's not physiological, it's psychological diseases. So you see, psychological diseases, we for depression, we see, oh, okay, it's a depression, we can cure it actually in 2 months or 3 months. So here I want to again you to come back over the churning over what makes a disease curable or incurable. Essentially, we are trying to cover that point. So basically, once again, coming back to what exactly is curability is, which is like more balanced kind of definition, is that basically curability amounts to likelihood or potential of a disease being cured or successfully treated. We can see, we get many cases of muscular dystrophy, and right now I'm having a case of multiple sclerosis from Puri. So you see, the technically disease is incurable, but the person has just started walking within 1 year of treatment. So now what? So you see the curability, and technically it had no potential of getting cured ideally, but it is recovering, and probably it will recover even well. So we have to really put up the both sides, because our medicine, for example, unfortunately, we read the medicine book written by whom? We read homeopathy the all medicine, pathology, surgery, we read Love and Bailey. Pathology, we read Robinson. And then for medicine, we read Harrison. So who are they? They are essentially hardcore like modern practitioners, and they will write hypothyroidism is incurable, because once the patient gets it of any reason, probably he will not never go back to normal, and he'll keep on having this thyroid supplement and to survive. But how many of us have seen that the patient could not only be withdrawn from all the thyroid supplement, but also withdrawn from homeopathy and still maintaining for years since now? I have many cases where the patient is totally recovered, cured, and yes, cured, because after 10 or 15 years the patient could not manifest any symptom, or they are regularly checking their thyroid, it's normal. So again, coming back to what exactly they are trying to point out, as far as cure is concerned, approach to disease and cure in the modern medicine, the conventional medicine says that pathophysiological approach kya hai cure ka, that targeting a specific disease mechanism, जैसे कि इन्फेक्शन हो गया, इन्फ्लेमेशन, जेनेटिक abnormalities. So they are saying कि when it's our pathophysiological approach where we will just target whatever the disease mechanisms are available, जैसे एंटी इन्फ्लामेटरी दे देंगे, एंटीबायोटिक्स दे देंगे, और any palliative therapy दे देंगे. Pharmacological intervention where we can just they are using certain drugs to directly alter the biochemical processes involved in the disease. So that's another approach. And because we should know, that's why I included all these factors. Now if you see, the homeopathy has put up miasmatic theory. Miasmatic theory means what? Treating the underlying predisposition, inherited tendency towards diseases, is something that miasmatic theory comes up with. Here they are saying that some dynamic vital force has to be restored, so that body's self-healing mechanism is kicked in, and the self balance, that is hormone, is restored, which Henneman tried his best to explain in aphorism number 26. But of course, if Dhanesh sir invite me again, then I can explain the modus operandi of cure in most cognizable and genetics and biochemical levels. I would like to share that too, that what exactly his 26 aphorism can be explained as in. So here Hanneman in his contemporary, with his contemporary knowledge, trying to say that somewhere फिर वो बोलते हैं ना कि होम्योपैथी जड़ से निकालती है. So what exactly is, we are not there treating the patient symptomatically, we are not palliating cases until it is really mandatory. We are trying that everything is restored permanently and body is self-healing. For example, for psoriasis, we are not administering any anti-inflammatory, we are not administering any steroid, but you see the immunity aggression of the immunity, autoimmunity, start getting cooler down, and you see that is in the form of reflection, in the form of recovery. A case of eosinophilia, you can see that eosinophils count start dropping, whatever reason it is there, but it goes back to normal. So what we are doing is, we are not giving any anti-allergic or antihistaminic, but we are just trying to manage that immunity aberration. Now the total game changer in every disease is more or less immunity, immunology. So that's why we try to attempt homeopathy as immunomodopathy. So because homeopathy ka actual literal meaning is has also invited lot of criticism के ठीक है, एक मंजिल से पर्सन गिर गया है and he has sustained injury, so similar but stronger, आप उसको सेकंड मंजिल से धक्का दे दो, he'll be cured permanently because so you see, so Hahnemann has termed homeopathy based on the kind of medications effect that are linked up with the, but we have to explain very loud and clear that homeopathy term does not justify its mechanism of cure. So first of all, we have to really erase that concept that homeopathy defines how actually homeopathic medicines are working. Homeopathy term defines on which basis we are selecting the medicine, and not how it curing the disease. And that's another discussion altogether, and with kind permission of Danish sir and Sani sir, I'll come again to explain that. But the cure has to be fundamentally addressing everything under the skin, under deeper organs, deeper part, wherever the actual essential nature of the disease is coming up, we have to hit that. So that is what they have tried to propose. Here, I would again say that, sorry, I think the slide was a little shuffled, but here the types of cure, medical cure, where they are saying that, we will try to, eliminate करने की कोशिश करेंगे any disease or condition with medicinal treatment. Functional, where we will control the symptoms with a progressive, but we cannot eliminate, for example, HIV or any HIV में जो फंक्शनल क्योर करते हैं, इनक्योरेबल डिसीज में जो भी फंक्शनल क्योर करते हैं, जैसे कि रोज हाइपर एसिडिटी को एक एंटासिड देते हैं, बट अल्टीमेटली क्योर नहीं होता है. अगर वो एंटासिड खाना बंद कर देगा तो ही विल सफर फ्रॉम अदर गैस्ट्रिक अल्सर एंड अदर स्टफ. सो spontaneous cure, where nature also recovers itself. So if you see, the types of cure in general, irrespective of any pathy, is usually either by using medicine, either by controlling the symptoms, or sometimes even nature recovers itself without any medical intervention. Now, advanced cure research that has taken place in the world map, let us see that. Now here they have there they have introduced precision medicine, and what we are saying that we are giving highly individualized medicine. This is nothing but the precision medicine. They have discovered now, after 260 years, they have discovered that we should give a very individualized aspect. I think most of us should also watch a cardiologist who gives a very good presentation, and where he has said that there could be more than 25 treatment regimen for a hypertensive patient. जैसे कि अभी anyone walking into any ordinary cardiologist, he has been administered with certain attain, certain dyslipidemia, anti-lipid lowering agents, and certain blood thinning agent, aspirin model. So 3 things are fixed. They will be administering them, and certain antihypertensive. So attain is antihypertensive, then lipid lowering agent, and blood thinning agent, that is aspirin. So that was a standard, that used to be a standard format or treatment protocol for handling hypertension patient. Now they have understood that no, it doesn't work everywhere, it doesn't work with every individual. So now they have said that based on your genetic, environmental, and lifestyle factors, we will give you medicine, and we will nicely call it as precision medicine. So what's wrong? We are also giving long back individualized approach to the patient. Now they are saying that now we have advanced the cure with the research, with that, as in we are administering and focusing more and more of immunotherapy, because we have realized that immunity is a perfect game changer. So harnessing the immune system to fight a disease like cancer, and even if you see most of infectious and non-infectious diseases, immunity has a role to play. And I think whenever we were studying immunology and pathology, word and word, every time and again, we were just getting so sure that we are on right track, and our homeopathy is actually addressing and modifying the immunity and curing any case with the appropriate immunomodification and gene therapy. Now guess what, gene therapy is correcting the genetic mutation to cure the inherited diseases. Now we have people who are been researching that, gene therapy, the homeopathy working on the genetics, so that the things have reversed to a great extent. I have heard people recovering things like muscular dystrophy, things like optic nerve atrophy, even there are certain school practitioners who are like who had been showing that they could recover many of the congenital structural issues, where they could just restore the lost organ altogether. And everything is evidence based. So somewhere, somehow, the homeopathy has proved more penetrative power and reaching power up to the genes in any which ways. Few peoples in homeopathic sector have been trying, and to an extent have established that we are working over genetics. So we can see and hear lots of genetic homeopathy brands. So yes, we do, homeopathy does touch the genes and its function, and it influence the function. Now here this slide will be incomplete if I don't mention the Human Genome Project by USA, which was completed, I think, before 2010, and where it has done actual chromosomal mapping, where each and every spot of the genetics genes have been identified, being responsible for what type of allergy, what type of infection, what type of diseases, what type of mentalities, what type of psychological condition that person is likely to get affected by. So everything is mapped now, and everything is established now. And my dear friends, एक छोटा सा secret I'll release, that this is what the internal essential nature of the disease, which is ever, Hahnemann has termed that, which would be ever remain concealed in the um, concealed in the inside that the human being, is what somewhere he had mentioned, that the internal essential nature of the disease that would ever remain concealed. And now the modern medicine itself has opened that internal essential diseases lies nowhere but the genes that are responsible over our chromosome. So this is how it is. So now let us come back to our competitive spirit again. So here, yes, I did mention here, Human Genome Project USA had proven that each and every disease has a gene as a root cause, and therefore cure term is in a way obsolete. Okay, so as to its complete resolution of disease and permanence parameter is concerned. So now, my dear friend, again focus. Hahnemann aspired that the cure has to be permanent, the cure has to be rapid, cure has to be gentle. Rapid and gentle he could establish. Permanence he was not able to establish. And out of that curiosity, the total discovery of you see the chronic diseases came up, that was mocked badly. But if you see that the theory of Sora is totally nothing but the theory of infectious and contagious diseases. So अब Hahnemann could not see that, but he said that the smallpox patient के room में लिखा हुआ later transfers the disease without having any visible evidences. He never knew that there are actually microbes, but he said that there is a contagion. And I think the era of Braziu, the era of that materia pickens and tolecosm, the person who could think that there is contagion, think that does exist, and for which he was prosecuted time and again. I mean, he should be worshipped actually, because he was saying that contagion where he did not know even cell that does exist. He could guess that there is something being contagion. उसके बाद में if you see Mendel, long back Mendel, Hahnemann knew that the diseases are hereditary. There is something that transferred diseases to generation, and that Hahnemann knew. He mentioned, he wrote, and we should proudly take the credit that yes, Hahnemann had all the guts and all the knowledge, and basically he was an intuitive intellect. He knew that, but he could not have any tools to explain what he's saying. And now we have everything open in front of our eyes to claim that what he was saying is right. So now here you will see that that's what the Hahnemann's aspiration was. Disease to permanent मैंने लिख दिया है, disease has, the cure has to be permanent, so I have to make it permanent anyhow. So that's why the absolute cure was his dream, and of course it's everyone's dream that we should cure the patient permanently. The highest ideal of cure is rapid, gentle, and permanent restoration of health, or then he has said not 100% diseases are curable, or removal and annihilation of disease in its whole extent. Nothing should remain inside. And then I had my organ teacher, Dr. Vyavhare, and I used to argue, sir, नहीं ऐसा नहीं हो सकता है, तो डिजीज पे जेनेटिक्स कहाँ गया? तो जेनेटिक्स है, जेनेटिक्स तो रहता है ना, सो परमानेंट क्योर नहीं हो सकता है. And he used to say, Miss Shukla, I think I'll have to take another birth to explain, but he need not to. I study it in myself, that how actually these terms or these facts are unfolding. So he's saying that removal and annihilation, and he also admitted the limitation that not everything is curable. So removal and annihilation of disease in its whole has extent in the shortest and most reliable and most harmless way on easily comprehensible principle is something that he dreamt as absolute cure. Now the game starts again. Now ultimately the cure, basically what it is, if you see the modern concept, if you see the homeopathy concept, ultimately the cure is somewhere addressing the root cause. Even they are trying, of course, I don't blame that allopaths or modern medicine is enemy of humanity and they are doing worse. They are doing what they believe in, we are doing what we believe in, but ultimately the purpose is same, that we have to cure, we have to find out how we are going to annihilate disease. We know that disease won't be ever annihilated, they will keep on coming in some or the other forms, but we keep on questing the cure, that how we are going to achieve the cure. So ultimately cure is addressing the root cause, that wherever it lies, restoring the normal status, the person is able to perform normally. Now the determinants of cure, how we are going to determine that we are going to cure. So here, infectious diseases, COVID, malaria, tuberculosis, certain diseases are curable, certain diseases are incurable. Non-infectious diseases, hypothyroidism, heart attack, some may be recovered totally, some may not. Genetic diseases, cystic fibrosis, sickle cell anemia. Environmental diseases, asbestosis, lead poisoning, and autoimmune diseases, so many the spectrum. So now here the thing is, I deliberately have repeated this slide, that curability, it doesn't matter whether it is acute or chronic, whether it is at the early stage or advanced stage, primary or secondary, simple pathophysiology or complex pathophysiology, it doesn't determine whether a disease is curable or not. Now then what? Who will determine that a disease is curable or not? Now the established factors that are there, and here are certain game changers for us. Now definitely there would be general health status of the patient, and age will make a big game changer, where the curability or prognosis is what we will call would be better. Genetic factors, if the person is predisposed, genetically carrying those load, you see, we take miasmatic history. What is that? We are trying to trace the genetics कि क्या क्या diseases हो चुके हैं, किस तरह का pathophysiology is predominant, what kind of disease the patient is likely to fall sick with. So genetic factors, comorbidities, what type of environment, what type of mental status, stress levels, what kind of occupation that he's making him predisposed to certain kind of conditions, and compliance, that how well he goes and take the treatment and follow the ancillary measures, would determine whether the patient will be cured or not. So there ultimately, who is cured? The patient is cured and not the disease, because disease के determinant तो ही नहीं, only patient के determinant है, patient factor ही हमको play around करना है. So treatment and options of modalities. Treatment options and modalities. Basically, what are the treatment factors? So effectiveness and availability of treatment makes a disease or patient curable. Expertise and experience of a doctor. Multidisciplinary approach. Yes, this is where the government has also started focusing, that not one path is complete in handling all the conditions, or one condition completely. Let us integrate on a standard and create a standard treatment protocol, and that is multidisciplinary or pluralistic healthcare system that government is keen to bring up very soon. So, and almost through Ayush hospitals being raised in various states and various cities, it has already been established in the back door or behind the curtains. Now, relative, common cold and infectious, where we will say, okay, it's cured. Autoimmune, you would see the disappearance of the episode and probably will say, okay, abhi ye pata nahi kab aayega. So I have seen my asthma patient not showing any symptoms forever in life, and some people keep on showing it every 2 years or 8 years or something like that. So we really don't know. But of course, whenever they will be fiercely exposed to whatever they are allergic to, they will come up with the symptoms. Chronic diseases, yes, of course, there are lots of uncertainty whether we are going to recover it or not, even with homeopathy. So the concluding point from my side is, every disease is curable and incurable based on so many factors I have narrated so far. Now the game changer thing is this. Can you hear the sound?
No.
Okay. Can you just read whatever is coming up and video is flowing smoothly?
Yes.
Okay. This is a live case that I have handled. So the most important part of the story is basically a skilled medical manpower or task force is more important than the infra. And everyone has to work together jointly and work hard towards achieving the things in a very, very focused way, understanding each other's scope and limitation, and establishing each other's roles and responsibility is something that today's mankind needs, that today's sickness or illness or disease demography needs. So basically, in front of true holism, no disease could and should be incurable is my conclusion. We can cure any and everything if we apply this holistic approach, integrative approach of all the systems. I think no disease should remain incurable. So ultimately, what I wanted to state or conclude or end my session with is, quest of cure should be only the quest of any medical science. Only that we have to, not what causing, what are the diagnoses, where we should go, from where it is originating, but ultimately how we are going to solve it, how we are going to recover it, should be the ultimate quest that whole medical system should be looking at and thriving to achieve. Of course, the proposition of pluralistic healthcare has been accepted after COVID-19. Whole world has accepted that not a single system of medicine is a complete to handle any and every calamity, and everyone has to come over a standard rules and principles together and finding out cure for any and every disease condition. And I think Ayush hospitals, the establishment of Ayush hospitals is with that purpose only. Hopefully, that gives us a justified, what we say, uh, justified approach, justified responsibility, justified role, and let that Ayush department or ministry not become just a Ayurvedic ministry. So for this purpose, we can win and we can lose also the game until we play it at a very core, where I think I can see that lots of uh, big names and big people are there, and they could be having their say and reach up to policymakers. So again, concluding, and sir, Danesh sir, forgive me that I'm creeping again, that we deserve a fair chance, and that fair chance has to be any which way, has to be achieved through proper policy designing, which is fair, which is just, which is balanced, and giving us a full chance to display. Because if you remember that our last sin, that we have to be capable enough, but if we are capable enough, we have to be given the chance, because until we give the chance, how we are going to show that what we are capable in? So here, whoever is there are having some say or some reach into the policies, I would appeal everyone to just right for the fair chance to homeopath, and we can actually change the disease demography altogether. So Dhanesh sir, your video is again on, so it's over to you now, and also the forum is open for Q&A, because I really wanted to have lots of Q&A, because it has to be more and more of interactive.
Thank you, Dr. Rashmi Shukla. It's really a brilliant session indeed. You really show the beauty of connecting every systems in a beautiful way. And that's what we are looking at. As you rightly point out, that there is a system to take care of homeopathy as well as all other eye systems together. But unfortunately, the funds are more going towards Ayurveda, but it doesn't matter much. Anyway, we are getting more and more allocation nowadays, and so that homeopathy will be a winner in the coming days. Our research people sitting at Delhi are also doing excellent job in trying to get maximum for this homeopathy. As as the discussion was entirely different subject, since cure and incurable, and what was the concept of homeopathy and what is the concept of homeopathy right now. Exactly, but there is no change in our concept and theories and everything. They're still as fresh as what animal wrote some 2060 years back. But the modern people, they are having entirely different views, but they are coming downwards and trying to reach running parallel to Dr. Hahnemann now. That's why they are now saying that the precision medicine is the time for precision medicine. What is precision? That is nothing other than the individual medicine. So both are we are running. They are running parallel to us, and so we can connect somewhere at some point in the future, thereby restoring the health of the person. That is what the primary duty of a physician can be achieved in the shortest possible time with every aid. As we know, lot of diseases, so-called modern diseases, are there naming, but whatever be the name of the disease, doesn't matter. What we can offer is a cure by all means. That's what homeopathy can do. Anyway, it is a time for discussion. I invite all of you to participate in the discussion. Am I right, Dr. Rashmi?
Yes, sir. Yes, sir. And sometimes I feel like it's more of nowadays what we see now, that where science we is showed that what Sanatan said years back. So similarly, the modern medicine proves what Hahnemann said long back. So we already have hands to raise. Ki, okay, yeah, हमें पता है. We know this happens this way.
That's
So so
that's
many
the reason.
incidences.
That's the reason why a lot of challenges nowadays we are facing rather than some 10 years or 20 years back. Because nowadays they are coming up, the so-called modern people are coming out and saying that homeopathy will do more damage to your kidneys, and liver and everything like that, because it is made up of spirit and like that. But they don't know how we are distributing the medicine. But instead they are saying that since it is made up of made in spirit, it will damage your kidney like that. In the earlier period, they used to say that it is placebo theory. Placebo, there is nothing in it, but it's only placebo. But that's
But then they have to look for their own stats, sir. Okay, how many renotoxic and hepatotoxic drugs they do have on paper, their own pharmacopoeia is saying that it damages liver and kidney. So you see your numbers and maximum patients that are coming up with, I mean, show the numbers. Just
yes,
tell them, show the
definitely.
numbers.
Yeah, all of us can understand that if you look at the dialysis center, why this much of people are they queuing in front of dialysis center? It is not because of any direct kidney disorder. Only very few among them are really kidney disorders. Actually, all others are iatrogenic, as we know. But
Right.
we are not going in that way. The discussion need not be going that way. Sometimes that itself may be the reason they may ban us from publishing the video in the upload. So I am not going in that way. Anyway, I invite Dr. Indani Bhavatkar to say, please unmute yourself.
The discussion was very helpful. Madam has nicely elaborated about the cure, which Dr. Haniman mentioned. Madam, as a homeopath, a common question comes to mind. Should we use this word in front of patient? Because we get many cases, acute and chronic. Because if we use the word cure, they basically catch us in scissors after a few duration of time. They said, you said cure and my disease is not getting cured. And if you say if it is incurable, they don't return back again. So how do you deal such cases? Can you elaborate it?
Right. So basically, based on their aptitude, we have to explain whether they they are explainable or not. So based on that, their aptitude, we have to tell them that the stage and the pathophysiology of disease that is there and the organs that are affected and the recovery probability over general parameter. So if you see to pick up the any book of pathology, surgery or medicine, and you see that any and every disease is almost incurable excluding infectious diseases if so-called curability has to be concerned. So you open any book and you will see all diseases are incurable, you see mostly.
Yeah.
So
Yeah.
here
No, but for patients, should we use this word or we should keep it reserved? That is my question.
I think we have to be really tactful because we should not overcome it. I always believe that we should over deliver. So we should rather say ki see, we will observe you few months so that you know how your body responds, and then we will can forecast that how many months it would take to recover your illness, to a great extent. Would be a more tactful and diplomatic irrespective
Yeah,
of whatever, because homeopathy mostly comes up with incurable diseases.
very true.
So
Second opinion doctors. We have second opinion doctors.
we are second opinion doctor mostly. So definitely a first and foremost condition, they won't come to us. So definitely mostly they are maltreated, they are spoiled, or barbad cases mostly comes to us. So that
Yeah.
time we have to be really be tactful, because sometimes I have seen even maltreated cases out of homeopathy only, having taking
Yeah.
lycopodium banam for 2
Yeah.
years or 3 years or 7 years. So
It
so
happens. So I think
this also happens.
we should be cautious while using the word cure of amongst patients.
Yes,
That
yes.
is
Once you cure, then you claim that you have cured.
very true because it's very difficult to prove yourself that you have totally cured the case. Very
So
true.
I
Very true.
think we should use the word when we will cure. That's why even while your reception tells any call he receives, they have to be say, sir, we can recover you very well. We have handled this kind of cases, but without doctors seeing it, we are not doctors to commit you over there, because patient तो फोन लाके पूछते हैं हमको ये lupus हुआ है आप क्योर करोगे क्या.
Yeah.
So
Yeah.
you have to instruct the reception कि उनको बोलो कि we handle these cases, we can recover these cases, we have history of recovering these are the testimony, but doctor has to see you and then only tell whether or to what extent we can recover you. So recover is a fair word in
Ah,
that.
that would be a word of caution also for everyone. Means that is
Yes,
very true.
yes,
Yeah.
yes. And I think that will make you legally safe also, because
Yeah.
nowadays I have seen that if you claim that you're curing something, I think law says that you cannot cure, so you should not claim that you cure.
Yeah,
So
and people do
legally also,
audio. Yeah, I've seen people do audio recordings in their pocket when they talk to us in the first meet. I've also witnessed that. So all
yes.
we should be all cautious for that. So it's a good explanation. Yeah, yeah, yeah.
And
Yeah.
many a times nowadays patients are so aware and so proactive. I had one case from Jabalpur, and she had hyperchromia. I mean, whether I'm saying it right, she has iron overload in her blood. So she was the cause unknown.
Overload.
Hyperchromia is what something. So I said ठीक है. I started symptomatically and other things, and within 1 month whatever, so we had like a habit of having call record or having screen record of video call, so that the training and purpose. So of course we don't produce it, but we should have the testimony, क्योंकि patient तो आ नहीं रहा है, तो how we are going to maintain that the patient has recovered. So after first prescription, she gave us a feedback. Yes, ma'am, I'm 60% better. This symptom, that symptom. I don't remember that case completely, but she said so and so. I said, okay, ma'am, theek hai, we will give you another medicine, this and that. And while going for the second level of prescription, the reception contacted ki share your all details, and we are dispatching your medicine again, and this and that. The person, and then when they ask for payment, now you'll have to pay this. So most of patient generally come to a deadlock कि मैम आप दवा बता दो हम खरीद लेंगे, and do not do that, because they abuse it. They just go purchase and eat out of control and spoil themselves, and then you would be sued because आपने बोल दिया कलकेरा का आप 200 खाना है, patient रोज खा रहा है. So do not do that, because that would be potentially very dangerous. So we just say that, see, we don't have OTC rule against dispensing the homeopathic medicines. We don't have strict OTC rules. So is there any, if there is any policy makers, I appeal them to create a strong OTC rules that no homeopathic medicine should be administered because it can kill. ठीक है? So that time the patient will be in soup and bring you along with in that soup too. So
But
do
actually,
not.
I tell you legally, whenever a patient asks us which medicine was given to me, it is a legal binding to all homeopaths that he should disclose the name. That is
Yeah, but
very
then
true.
tactfully you have to say that, see sir, these are the reason that we don't defer, we don't prefer to disclose. We, in two condition, we will give you, we will disclose the medicine. Either you are deciding to stop taking medicine from us officially, you're discontinuing the medication and not abiding to our instruction, means then we are legally safe that after that whatever he
Yeah.
abuses, we are not responsible. Or you are recovered, आप पूरे ठीक हो जाओ सर, हम तब बता देंगे, या तो आप बता देंगे तो आपको हम ट्रीट नहीं
But
करेंगे.
but ideally they have a right in court to ask us for name of
Of
medicine.
course.
So
So
in soft way
we
we can
also
tell
have
them,
a choice. We also
yeah,
have a choice to
but
whether to
we can
continue treating them or not.
face it, yeah, many times you must have hesitated. But it's a, I suggest you a very thin line between that. We can
Right.
tell them you can have this name of medicine, but we request not to self-medicate because overuse will cause proving on you. This what we can just tell
We
them.
can then have that documented, but patients are really,
Yeah, I
really
know, I
check
know,
our
I know, I
patients.
know,
So
I
they
know.
don't listen and they'll spoil, and then we will
Yeah,
be in
yeah.
soup to, doing
Homeopathy, they
that
come
stuff.
to me. Homeopathy, they come to more for treatment to me, and they ask me what is the remedy. What is the remedy? They are only interested in that. That is
Yeah,
there.
and many a times then this becomes more horrible when the cases are being handled online. So
Very
you
true. Very
have to
true.
be technically and legally very safe while handling the cases online.
Yeah.
Everything has to be over phone, text, क्या हुआ है, ये दवा है, ये प्रिस्क्रिप्शन है, इसका फोटो भेज दिया है, अब उसके
Correct.
ऊपर आपने अब्यूज किया है, आप रिस्पॉन्सिबल, हम कुछ नहीं कर सकते.
Very true. Very, very true. So that is a good explanation, madam. Yeah, yeah, yeah. Okay.
Anyway, it's a very, very good discussion. And now I invite Dr. Ram Paresh sir to say a few words as well as you can say vote of thanks to the session.
Thank you, Dr. Dhanesh ji and Dr. Indrel sir, and congratulations, Dr. Rashmi Shukla madam. Every presentation is done dynamic, and during presentation laughing tendency and dynamic person. Dr. Shukla madam is a dynamic person. Very good describe the curable and incurable according to homeopathic science. But लेकिन homeopathic medicine is a curable according to way of treatment. Miasmatic cause of disease, miasmatic, and medicine is a miasmatic. तो It is beauty of homeopathy. So very, very thanks, Dr. Shukla, sir,
Thank you, sir.
madam. Behalf of IFPH whole team. Very, very thanks. Again, presentation. Thank you.
It was my pleasure, sir. Thank you so much for your patient listening. Thank you so much.
Thank you, Dr. Rampresh, sir, and Dr. Rashmi Shukla. Hope you will come out with some more subject which really enrich us to think in a different way. That's what we are looking at you from your presentations all these days. Thank you all for joining this evening. Thank you all. And
Thank you,
tomorrow we will have a session from Dr. Kalyan Suru, and doctor will be talking about psychosis and homeopathy. With that, we come to the end of the day, 1648.